Good evening and welcome to Tabbetha's Reassignment Surgery blog episode 2. So we're now less than a month to my surgical date in Thailand. So I thought I do a video discussing how I'm feeling, what's going on the lead up to the surgery, and I thought I'd get my wife Michelle to come on and give her feelings and views about my surgery. So, in the last week or so, I have been speaking to my contact in Thailand, Shari. She's very good. She's been my liaison between myself and the PAI clinic and the surgeons. My surgeon is going to be Dr. Burin, and his reviews are excellent. He does both reassignment surgery and other plastic surgery. And I have decided that while I'm in Thailand having my reassignment surgery, I am going to have breast augmentation done at the same time in the same procedure. So I will have top surgery and bottom surgery all on the same day with one hospital stay. Part of the reason it reduces the cost, reducing the risk of having several general anaesthetics for surgeries, and one set of pain. Having the surgeries done together should minimise my experience of pain. Yeah, you'd be in two different areas at the same time, but I'll be able to cope with that, I'm sure. Yeah, as I said, we will fly out to Thailand on the 8th of December, and my surgery date is the 12th of December, so we've literally just gone past the 1 month date before the surgery. The surgery, we have 4 days in a hotel where I had to see a psychiatrist, have blood tests done, have ECG done because I'm over 50. That's one of the requirements. And hopefully I'll have some time to do a bit of sightseeing with my wife, Michelle, during that time prior to going to the hospital. Once we check out of the hotel, we will both move into the hospital for 5 days. The room I have been allocated and booked has a sofa bed, it has a dining table and chairs, it has a small kitchenette with a microwave and fridge, so Michelle can prepare food and we can stock up on stuff in there. And Michelle can sleep in the hospital room with me for the 5 nights I'm in the hospital, so she'll be with me throughout the stay, which will be lovely. It'd be nice to have someone there to look after me and support me and not have to rely on the nurses all the time if I need something. My feelings about where I am now is that, yeah, it's exciting. I'm looking forward to it, but I'm also nervous and a bit scared. Although I'm a nurse, I've seen surgeries before. I've had a couple of surgeries this year, both elective and emergency, and I've got scared between all of them and before all of them because that's human nature. And yeah, and I will be scared the night before the surgery, but as I said, it's what I need to deal with my dysphoria. It's what I want as well. I'm starting a new job in February out here in Canberra in Australia, and I want to start this new episode of my life as my complete self. So yeah, it's nice now that I know the name of my surgeon. I've been able to read up about his qualifications, about his feedback from people who have had their surgery with him, and not just reassignment surgery, augmentation, breast augmentation, facial surgery, all the surgeries that transgender members of the community have. And I'm very pleased to read that he gets very positive reviews, which gives me confidence. With regards to the breast augmentation, it's something that I've only decided to have done in the last week, and that's because I've managed to raise some finance to allow me to have it done while I'm in Thailand. Again, since I've been losing weight, getting ready for the surgery, and with losing that weight, my breast development has shrunk. So it's more imperative for me to have this surgery now. I had very little breast development prior to losing the weight, and the weight loss hasn't helped. So again, it's something else which I have decided that I would like done before I start my new stage of my life out here in Australia with my new job. Yeah, as part of that process of getting ready for surgery, as I said, I've been losing weight and it's been successful. And part of that is a very big incentive is that I had to be under 90 kilos for the surgery. That's got anything over that is regarded as a higher risk, and because it's a higher risk, they will charge a 10% fee on top of the normal surgical fee. So that's a very big incentive. It's about almost $1,000 that you would be charged if you're over 90 kilos. Prior to surgery. The other thing I've been doing is I've been working on, I've been doing strength training with a local gym in Canberra called Flow & Co. And they talked to me about what I want to do, and I've been working on my pelvic floor muscles, so to help with the recovery from the surgery. Been working on my core strength as well, again, help me to recover from the surgery as much as possible. And they've been very good. They understand that after the surgery I won't be able to attend classes for a few months, and they will put my membership on hold, which is very generous of them. But they're keen to see me after the surgery and keep in contact with them. And I've made new friends there, which is lovely. I've been getting supplies ready for going out to Thailand. They do say that they will provide the supplies needed, but I'm always one who plans for the worst. So I've got my own supplies in case they don't supply or I run out or something happens. So they recommend condom use over the dilators, so I've got some condoms. My lovely wife bought me a pack of 144 condoms. I thought that a bit extreme to need that many, but I'm sure I'll use it over the time with my dilation once I get back here. Lubricant, I've chosen a nice big bottle of lubricant. I've got nitrile gloves for keeping my hands as clean as possible when dilating and protect myself from getting any infections. I've got sanitary pads, which is recommended at the start, post-surgery, to protect your underwear from any bleeding which might occur. And I've got bed pads for when I'm dilating, so keep the sheets clean in the hotel. And there's other things they recommend: cotton wool for doing the cleansing of the wounds post surgery. I've also got some books to read for my recovery, and puzzle books. But again, as I said in my previous video, I'll be trying to do a surgical blog video every day during my recovery and before the actual surgery, once we get out to Thailand, just to keep you guys informed of what's involved with having surgery out in Thailand. And I will do as much as I can when I'm recovering. So on that note, I will hand over to my wife Michelle to give her view about how she feels about me having reassignment surgery and also the breast augmentation. So if you'd like to come up, Michelle. If you'd like to come up, Michelle, and come and have a seat and have a chat.
Hi everyone, my name is Michelle and I'm Tabbetha's wife, and look at these nails, aren't they fabulous? We've got to talk about my nails first, aren't they great? Tabbetha's been doing these video journals on her journey, on her transition, and no transition is the same. Everyone's different and we go through different emotions and similar emotions, and I think my lipstick's wrong there. But here we are talking about Tabbetha's transition. We met over a year ago, got married, and I went through prostate cancer, so I had radiotherapy, which meant I can't have a vaginoplasty, but I can have a vulvoplasty. And very depressing. So how do I feel about Tabbetha getting her vaginoplasty? I've got several feelings. Like, I wish I could have one, but I also accept in life we have all different things. Like, I've grown naturally C-cup boobs, where Tabbetha's got mosquito bites. So for her, implants are necessary. I mightn't need that. So she can have a full vaginoplasty, I have to have a vulvoplasty. But I am kind of excited about having something done. But just, let's go away from me, because we just got quite a bit on me, really, didn't we? The nails say it all. I'm a bit flamboyant, just a little bit eccentric, they say. But anyhow, with Tabbetha, I've got mixed views on it. Like, I always knew this was going to happen. The time ticks by, but we fell in love, and I'm not into women, I'm into men. But Tabbetha, something sparked, and it happened, and we're married, and very happily married. I worry about the surgery. So not that, it's a heinous surgery or something, it's just that, it's a big surgery. And I don't think Tabbetha will make a mistake of changing or doing this surgery. She won't change. This is her, and she, I can guarantee you from everything I know, she's absolutely trans. She needs to have this reassignment surgery. I'm just admiring my makeup. I've been really getting into makeup lately, but besides that, she really needs this for herself. For me, at the moment, I must admit, when my urologist said the other day that I can have my vaginoplasty on the 23rd of the 7th, 2/25, I'm excited. But I do think of the complications, and what if she died and then I'd lose my soulmate? What if it didn't look right? Yes, you can have revisions and you can spend thousands, because being trans is not cheap. It's really expensive. Like, being a woman is expensive, but being trans woman is more. So, I worry about those things, but, so many surgeries go right. Tabbetha's a good healer. She's had, recently her gallbladder taken out and stuff, and she healed relatively well. Bit of a sook with pain, but she's good. Yeah, I don't know, it will be interesting. And, when we sleep, obviously together and naked, and what will it be like with not having a penis and having a vagina? I don't really care because I love Tabbetha as a person. And yes, it doesn't mean I'm not attracted to her sexually, but it's just the fact that, it will be different and it takes time. So when Tabbetha had her voice changed, I mean, this is a prime example. And this is coming from someone that, is in the situation, is Tabbetha had a very deep voice, quite a masculine voice, and being gay, or well, I'm not a gay man anymore, but being into men, I quite like that voice. But then she had the surgery, and I can totally understand why, because it was really deep. And it took me a while to adjust. But it wasn't that I was angry or upset she had the surgery. It was just that I've got to adjust to this. So my wife's going to have this surgery, but on top of it, it's not just that, she's going to have these huge boobies. She's going to have titties, size double D titties. And, you know, it's a big shock, all this at once. So for me, yeah, I'm a bit overwhelmed. And how am I going to feel, like being selfish about it? How am I going to feel when, Tabbetha comes out of the hospital? She can't even get through the doors, her boobs are so big, and she's got a vagina. And I'm the same. Just trans Michelle with boobs and a penis. So, I don't know, but I am very excited. I am happy for her. So this is all very mixed, but I'm a person that just speaks it how it is and what I think. And, I'm neither right or wrong. This is just a feeling, but I support her totally. I love her. I'll be there every second of the way she needs me. As you know, really exciting. I get to stay five nights in a hospital room on probably a fold-up mattress. Not accustomed to it, but I better get used to it. It's going to be a time for us to get even closer together, and also, when I have my surgery next year, it will just be something a bit different, but, we'll be the same. And I think that's, where having a relationship with another trans person is actually really good. Our relationship was not meant to happen. It was purely through me realizing I'm trans. I'm from the UK too, so it's like I want to be part of a group, UK trans support group. How ideal. I applied. I said I'm in Australia, but I go back and forth, and they accepted me. And there was a picture of Tabbetha as a man, and had psoriasis, me too. And I was looking for a trans sister, and not a trans sister radio. I was thinking of a trans sister, someone that I can do this journey with, that we can talk about what the hormones are doing, or, I'm having this or that, or oh my God, how to draw my eyes like this, or how do I do it like that, or whatever it is. And I reached out to Tabbetha, and I didn't look at her or as a him then and think, wow, he's hot. He was far from it, believe me. And nice eyes, but wasn't a looker, darling. No, wasn't a looker. And I just reached out, and suddenly Tabbetha wrote to me and said, oh, look, that would be really good. Why don't I call you now? And I was like, oh my God, I can't, this person's going to call me. I mean, I asked for all this, but oh my God. But I answered the phone and we chatted, and it was just very natural. And it just happened. And I told her in that conversation, I'm telling you girls and boys, whoever's watching, or whatever they, thems, whatever, I told her, don't go leso on me. I'm not a lesbian. And look what happened. So maybe witchcraft is real. Maybe she's a witch, but no, the truth is I am really into men, but I am also somewhat bisexual, I guess, because to me, it's the person you fall in love with, and Tabbetha has that, and I support her. So, conclusion, with all that blabber in between and the stuff I'm saying, which I seem to be able to say a lot, I'm proud of her journey and what she's gone through. I'm proud that she soldiers on no matter what. She had a hate group attack her at one stage, and it's like, I don't think I could cope with all that. But Tabbetha soldiered on. Yes, it affected her at some points, but she soldiered on, and she's got through this far. And, I really think it would be damaging to her not to have this surgery. And, this brings me to even children and the whole topics and stuff about, reassignment surgery and stuff. I think it's really tough. I can't have an opinion on children, and I don't really want to because I don't know what, but I know when I was a child, if I would have had the chance to transition, that would have been the best thing for my whole life. So from someone who's trans speaking, who came out at 53, I know, I'm thinking no way, and definitely not 54, but yep, I'm a 1970 baby. But no, seriously, I know, I didn't know I was trans back then, but there was all these signs, and if I would have realised that and could have transitioned, I would have done it, and I would have been so happy. And but life takes us into different directions, and I've had a great life, and I met Tabbetha, so I'm happy about that. Anyhow, guys, I'm going to sign off. So I'm Lady Michelle, and it's just been really lovely to sort of come into this YouTube channel, I guess, and there'll be some videos we do together, like in an interview talking, and just about current things. And the thing is, those haters out there, just go hate somewhere else. Be your own haters, because you have people that are seriously trans, and they, it's not a choice thing. You have to do what you have to do. It doesn't affect anyone, and it's certainly not affecting kids. It's like saying, oh, drag queens shouldn't go to school and entertain. I mean, how many drag queens rape children? That it's the other way around. So I think what we have to do is like be true in ourselves. So I like to be very glamorous and jewelry and this and the eyes and that sort of stuff. But then my wife, she's more the country lady. And she likes, that sort of country clothes, and she likes nice dresses, and she likes evening gowns and that. But I'm always like this. I just love glitz and glam and stuff like that. So we're all different. And I think, I think of it's like trans now is a big umbrella term, because someone non-binary is considered trans, and I don't see how that's trans. And, there's confusion amongst our own community. And I think the most important thing is, I am Michelle, and this is Tabbetha, my wife, and that's what we are, before we're anything else. So, wishing you all well, and I'll be seeing you again, and maybe something more exciting or fun. And my nails will have to be different, and they're a bit short, aren't they? I know. I have to get them longer, and some eyelash extensions, and a facelift. Look at that. All right. Thank you. Bye.
Thank you, Michelle, for that insight into yourself and how you feel about my surgery. And yeah, I appreciate your honesty about how you worry about me, but also how me having the surgery affects you because of your situation, and how the prostate cancer has affected your ability to have surgery. As I come to the close of this, we will be doing more videos as we get ready to fly out to Thailand in early December. And as I said, we'll be doing them throughout pre and post surgery and throughout my recovery. And I will continue doing my videos about my actual transition journey, about what's going on in terms of that. And those who have been watching my videos might have noticed that my hair's different. I have now started to not wear a wig anymore. My hair has grown down. It's taken 2 years to get this long, and I'm confident in going out without wig now. So that's a big step forward. When I start work, I won't be wearing a wig to work in my new job, and that's who I am. I have the confidence to go out without a wig now. So I will sign off and say I look forward to speaking to you in early December. Michelle's just in the background there. Yes. And bye bye. I hope you enjoy this video and find it informative. Enjoy your days.